Hello, everyone, and welcome to the Quorum Podcast. This is where academic medicine meets remote, austere, and resource-limited areas. Welcome back to the program. This is Aebhric O'Kelly. This week, we're talking to Dr. Theo Aslanidis. Theo is running our doctoral program, our Doctor of Health Studies. He is an MD, PhD, and he is from Greece. He is a professor of critical care and EMS at a university in Thessalonica, Greece, and he has been teaching for the college for a few years. Theo, welcome to the program.
Yes, first of all, thank you for the invitation. PhD, I'm currently working as an ICU consultant and anesthesia also. I have worked in the past in the EMS, in the Greek EMS for 5 years, and I also am teaching there in paramedics school and in EMTs. As you remember, our collaboration started about 4 years now.
Yeah, it's been about 3 or 4 years. Yeah.
Yeah, after I reached an online course about Aebhric, and that triggered my curiosity about Coromant. I honestly am glad that I did open that route for collaboration. It's very intriguing to me and very interesting.
So you have impressed me, Theo, by you continue to do CPD and not just like at your level as an MD or a PhD. You're doing CPD at just all levels and at vast variance of topics, and that really impressed me when I saw that, and had to meet you and have a chat, and then you are you were hired on to be head of our postgraduate studies, and you're heading our DHS, our doctorate in health studies.
Yes, I will. First of all, let me say that I'm lifelong curious. So it's interesting to me to refresh what I know, to see how the CPDs of all levels are constructed, because they offer me a different optic of structuring knowledge of education concepts and of my knowledge as well. And that's why I'm always seeking to do some CPDs in all levels. I don't care about my level exclusively. Now, as for the role in Quorum, I would like to rephrase it as much more of a helping hand to the candidates of the DHS, and not so much as a teacher or as a mentor. I would like to collaborate with different people, different cultures, practice of education, and that's interesting. It's an interactive role, and I'm always a team player. I perceive things, and I always look for the feedback of the team. So in that role, I always look in interactiveness.
So I see that, and I see how you interact with our doctoral students. You do have a quite an international cohort. You have the North Americans, you got Europeans, you got Africans, you got someone from South Africa. So you got a bunch of people that you are leading through the doctoral program for the first cohort.
Yes, indeed, the Cornwall gives a fascinating chance to collaborate with a worldwide group of people that each of us improves the others. I don't discriminate the roles of teacher of all or the candidate. I think that we all give to each other so that we can go a step further. And if I can help them to achieve a PhD, then it's great for me. And I also have a lot to gain in that journey, in their journey.
Indeed, and they're going through the first cohort. There's two modules into it, and they're starting the third one sometime in early 2024. And you have paramedics on it, so you have uh, uh, paramedics that you teach in Greece. So you are part of the paramedic, and you said critical care as well programs in the university in Athens.
In Thessaloniki, not in Athens.
Thessaloniki. Yep.
Thessaloniki. I'm participating mainly in research projects and not so much in teaching. But regarding EMS, yes, I'm teaching over 15 years in the paramedic schools. We in Greece here we don't have the variation of levels that are used in US or in Europe. So it's one school for both EMT and paramedics.
So, what are you finding that your EMT and paramedics or your EMS workers in Greece? What are they researching? So, you're helping them through learning how to do research, or you're bringing them into looking at PubMed searches and writing original thesis. What topics are they covering?
First of all, I am helping them to see the data in order to find the research behind the daily practice because we usually have a case, another case, and that daily burdens often disturbs us of finding research opportunities, which in most of the cases are in front of us. And that's the big challenge for me. Because if you teach someone to notice uh, everyday things from another perspective, then it's easy to go the steps further. Easy in frame that you will start to ask questions how we can do that and if we can do that, pursue the research topic or publication or an improvement in our daily practice. So that's the main question that I have to learn or to provoke them to search, and the rest of it comes afterwards.
Yeah, that is a challenge to get people like me who are very used to hands-on pre-hospital work, and then getting them to think academically. It's a challenge, and it's impressive what you're doing.
We have conducted quite a lot of research, for example, in when we had the refugee crisis, or currently I'm working on a project about hospital evacuation, and we're about that assessment in daily practices, audits, or similar projects.
So we have a lot of pre-hospital people listening to the podcast. What advice do you have for someone who is just starting out on research? What methods do you suggest them to start with, and what topics would you give them advice on?
First of all, be curious.
Yeah.
Yes, to ask why. and not just to say, okay, that's done, let's go to have a coffee and take a break. Just sit down and ask why. Why did it happen in such a way? Why did I perform in such a way? And then stop and look at the data. Find the data. Learn how to search your service, your organization about, or your archives, how complete they are. What do I have to do in order to make them more complete or to improve them? And that's the first question. Just be curious, because the our worst enemy is habit.
Mm.
After some time or a lot of time in practice in our daily life, we are used to do our job and that's it. We stop thinking about academics for others, things like improvement or gaps in practice or even in law. It's why not? You just have to start thinking about them, and then you'll find them. Even in a village 100 kilometers from the nearest town, or in a helicopter, or even in a refugee camp. So my first advice is first be curious, be child in
Mm.
in that kind of sense, so that you can spot what is in front of you, and then you'll start figuring out what you will do with your data, which is your experience and your college experience and your knowledge and your college knowledge. That's it. Simple yet difficult.
That makes sense to me. I'm thinking of the few postgraduate degrees I've have, and the writing that I've done, the publications that I've done. It's all been on things that I find fascinating. It's all been on things that have found me curious. And if I start writing a paper for a journal article and it's not interesting to me, it's funnily enough it never gets finished. It's just not interesting to do something that and go through the arduous process of writing a thesis or even a doctoral dissertation and not have that curiosity would be a challenge. So I really appreciate your first and largest suggestion, which is yeah, be curious about what you're writing on.
Yes, you have to have an internal motivation. If you don't make research for research, you don't make research for others, even if that sounds a bit cynical. You don't make a publication for just adding papers to your CV. You making this, or you getting all the work that is applied. First of all, because you're interested and in doing it, without anyone telling you that's have to good for your CV, it's good for your thesis, it's good for no, it's good for me. I want to do this. I never, despite what it will come up, because often you may start something that you think is interesting, then you may end up with nothing. Or, more frankly said, in something that is not so interesting for other people. So,
Mm.
uh, the first thing is do it for yourself, and then it will come out good.
Yeah, I definitely can see that in my own writing. And what's really interesting is you can start with a topic that you're curious about, and then as you get more and more into it, you're doing PubMed research and studies, you're finding it even more interesting, and then it feeds the fire in the belly, I call it, like the feeds that passion on what you're writing about. And for me, it's austere medicine, critical care, ultrasound, things like that are just fascinating, and that just continues to feed the curiosity. So it's a self-feeding fire after a while.
It's never ending. It's a journey that never ends. You have a bit of momentary satisfaction if you reach a goal, and then the next moment you see something else. And if you have finished the project on the next day, you look back and you say, okay, that was good, but something else could be done. And that's the reality. Knowledge is never ending. So it's up to you to keep up the interest, if you have interest in doing that, without waiting for any prize or any publication. You do it because it's a part of your culture, of your character to search and to write something and say, well, this is me. Uh, because a publication is opinion about something, and then you sit back and you hear the comments, bad or good. That's it.
So
Simple. Excuse me. I'm a bit far from what concept would order or rule or whatever says to us, but this is how I see things, and that's it. That's the reason why I'm so fascinating in researching and learning new things or refreshing in a level that's lower than mine, or some people say that it's lower than mine. It's we forget, we learn, we again forget, we must again learn. So it's a never-ending journey for me.
So, what advice would you have for the paramedic or pre-hospital provider that is just starting out with writing, or what techniques or what? So, when I talk to you about some of the research I've done, and you laugh because I'm always on about pre-post studies and Delphi, and yeah, all my pitches are kind of focused on those two because those are what I'm comfortable with, but what and your suggestion to me ages ago was branch out and think outside of those two. But what advice would you have, or what system would you suggest people use who are just starting out? What's a good, easy to understand system of writing?
Frankly, there's no easy system of writing. You learn by doing it. That's the most efficient way. Even if you seek education or read thousands of books about how to write, how to conduct research, how to synthesize all of the information that you have in front of you, it's not until you actually do it. So that's the path if you want to learn it. Do it. And of course, you'll make mistakes. Always do. Of course, you have to rewrite and rewrite and rewrite everything that you've wrote before 1,000 times. All of us did. But that's the path. That's the road. The advice is go out and write something. Then read it. See how you could improve it, and then give it others to improve it also. And there is no easy way to learn or to be ready for writing. And as for the methods that we are choosing, it's again the same as in our daily practice.
Mm.
We do what we feel that we're comfortable and we're good at. Uh, that's the same. I know a dozen of techniques, but I'll never risk or to do harm just in trying to have a first attempt on a method that I haven't done before in my daily practice. So that's the same in research. You choose the methods that you're comfortable with. If you're doing all the project by yourself. Now, if you are participating in a team, then it's a good chance to learn something new or something, another technique, another method, and by collaborating. That's why research, and not only, is a teamwork. You can't do it by yourself. At least I can't. And that's why collaboration is essential. You're uh, learning constantly, both about the reading, the writing process, and the assessment of the data you have, and the methods that you're about to use. And by experience, you get more options to use for the future project.
Teamwork really is important. I've written far more of the five publications I have. I haven't tons of them like you do, but it's been teamwork that has pushed that over the line. Trying to self-write a paper or an article by yourself is rough. And you're right, having a team there to bounce things off of and have ideas that I wouldn't have thought up, and they added to it. So your two main suggestions is be curious and teamwork. Um,
Yep,
it,
definitely.
that that's really good advice. Um, so any other suggestions or advice you'd like to give to the listeners out there before we close?
For start and for the band, that's enough.
That's good. All right, Theo, thank you for being on our podcast, and I really look forward to seeing what you can do with the doctoral program as our students go through it, and you're, of course, on the master's program and even the bachelor's, you're doing the research components. You are a valued member of the college, and I really appreciate your time today.
Thank you for allowing me part of that team.
This has been a presentation from the College of Remote and Offshore Medicine. If you would like to earn CPD credits for this podcast, you can join the Council of Members. Being a member of the college gives you free CPD credit, free access to our virtual field guide, and discounts on our e-learning courses. You can join the team on our college website at quorum.edu.mt.